Hello listeners, it's Trish Hammond here again from Transforming Bodies, and today I'm here with the amazing Dr Davin Lim, and I've got a few questions to cover with him today, so I'm pretty excited. Thank you for taking the time to talk to me.
I was about to say, women have called me worse than it's a nice privilege to actually be introduced like that, so yeah, no worries.
So look, I've got to get my questions around the right way. So you are probably one of the most recognised aesthetic dermatologists in Australia, in Queensland, Australia, if not even the world. Can you tell us, how did you get into it?
Well, I wouldn't say it's a long story, it's actually pretty short. I love doing things with my hands. Yeah, dermatology gives you a really good foundation in regards to both the basics of skin, but also skin disease. And if you can treat disease skin very well, and you've got an artistic flair, that's where aesthetic dermatology comes in. So half of what I do, yes, is aesthetics. The other half is medical. So medical, we're talking about scarring, we're talking about sunspot, signage. There's a crossover with that, and birthmarks as well. So there is, once again, a crossover between aesthetics and also functional or medical dermatology.
Mm-hmm. And I guess it is the biggest organ of the body, hey? So
It is. And I guess, the other thing as well, as part of actually me being a dermatologist is, like I said, it's the advancement of technology, which is what I'm super keen at. Because I've been known to be a gadget guy, so every time a new gadget comes out, whether it be a laser or energy device, I'd like to find the physics for that.
Yeah, oh good, I've got a question on that one. That's perfect. So tell me, you've developed a unique style of what you call freestyle filling. Can you tell us a little bit about that and just tell us a little bit about that and what it is?
I think, to be fair, look, it's a name that most dermatologists know. Well, most aesthetic and procedural dermatologists who actually call themselves that actually would know how to perform. It's it's nothing special in my opinion. Plastic surgeons, dermatologists, we all have our own way of filling. So for patients, I guess to make it simple, patients are actually given regions to treat. For example, eye cheekbones, lips, noses, and volumization, for example, chin. These are all the top areas that are filled. For someone who's doing freestyle filling, we basically, are entrusted by the patient to see which areas may need enhancement and actually address those areas. So it's not localized to, for example, higher cheeks. When we look at freestyle, every patient that comes in, we can see areas which, in our opinion, little tweaks here and there, the patient actually looks better. Not different, but looks better aesthetically.
Yeah, I know what you mean, because I like to go, as we were talking before, I go to one of your colleagues and I just basically go and say, can you just do what needs to be done? And he's there with his needle, it's like a paintbrush, he's like, and I come out, I just look like me, and then I just get you look really good, and it feels good, so I know exactly what you mean. Yeah. That's freestyle filler.
That's freestyle filling. A lot of the aesthetic dermatologists and plastics, we have 95% of the time we're very similar in what we do. That 5% is what makes us unique in our own specialty or in our own branding. But largely, when you see someone of that standing, we agree.
Yeah. And so on that, you say that injecting is an art form. So tell us on that, why is it really important to know the anatomy? And when someone's looking for a practitioner, what advice would you give them to find someone who's properly qualified to get done what you want to have done? Like, have you got anything that you can share on that one?
Yeah, I think, there are a lot of great injectors out there, brilliant injectors. In fact, I've learned from many injectors who are not specialists, because they've been doing it realistically for a lot longer than most, I'm not saying all, but most dermatologists. So I came relatively, late in the field. So I came when filling just started, which is about 15 years ago.
Oh, that long ago?
Yeah, that long ago.
Wow.
I'd still consider that early, because you have the dermatologists which preceded me, and a lot of the aesthetic physicians preceded me, they were using bovine collagen. They were using collagen from animals and having test spots, test patches, and seeing whether they react. Well, I was relatively lucky because I came in when hyaluronic acid fillers were emerging, which meant it made things a lot safer, more predictable, and then So I think one of the most important things, apart from art, art I think is very important, because you can be a great anatomy lecturer, but whether you can see things or not, if you don't have that, I guess, insightful artistic eye, no matter how good with your anatomy, you're not going to make a good filler. Not a good, I guess, procedural physician. So I think it's important to have both. Anatomy to respect the safety, and then an artful eye to deliver the outcomes. And I guess the most important thing is, because we all, like I said, we all have, the good guys will always know the rules to follow for facial harmony. And that one is through reputation. And I guess word of mouth is very important.
And I guess as well, you get to look at some before and afters, and like you go into a clinic, if you go in there and someone's got the full, like trout pout, big pub thing, and you don't want that, well then you know not to go there.
Absolutely. And I think it's much, the way I say, it's much like a haircut. Right? You go to your, I guess, hairdressers, whatever, who are, I guess, known for that particular style, who can actually resonate with you. Because at the end of the day, it's still your choice. And we just have to guide you. But if you go to someone, for example, a master hairstylist, a director, and you ask them for 1990s Sonata kind of look with a shaved head, chances are they probably won't deliver that to you. So I guess that's very similar to what we do.
Yeah, that makes so much sense as well. Because if you're the person that wants that, well then of course you're going to go there. So, All right. And I was going to ask you, so you perform probably every non-surgical option, lasers, injected here in your clinic. Can you tell us, like, is there something that sort of is a bit of a standard, or something people are asking for a bit more that you've noticed over lately?
I think I've been fortunate enough to be trained in the UK, in the US, in Asia, and in Australia, and I guess everywhere you go, there are what's known as trends, and the trend might not resonate within one country to the other. But what universally I think people want, or people are looking for now, is because a lot of people are time poor. They don't want long downtime procedures. So I wouldn't say gone are the days. I'd say there is a less demand for things like facelifts, where it's more invasive, and there's less demand for things like laser surfacing. Remember, if you've only got one tool, then everything, for example, if you've got a hammer, everything looks like a nail. So I think it's very important to actually have these skill sets so that you can deliver to patients what they want. And I think it's the low downtime procedures. So there's a huge increase in fillers. And things, for example, like micro BOTOX to treat pore sizing, to treat wrinkles and improve skin texture and pigmentation.
And for those that don't know, so the micro Botox is just like Botox, but just in kind of like micro doses mixed.
It's micro doses, so you can various delivery systems. Once again, this is not it's not something new. It's something which is just another avenue to deliver results to what patients want. So whether it be micro Botox or micro fillers, you're basically using small amounts scattered over wide areas that actually give a very low downtime. All right. So I do believe that this is what more and more people want is that low downtime procedure, but also most importantly now is to look natural. So I would like to say gone are the days where you have trends where you have big lips, but we still see that. Trout pouts and all, and yes, I cringe when I look at that. But I think it's now. I think people changing, and for the better. I think.
And I think as well, one thing I've noticed, which you've noticed as well, and you see it on a lot of before and afters, where like faces are getting sculpted with fillers and Botox, just like no surgery, but just the defined jaw, the narrower face, the bigger chin, and it's all the injections, like.
And I think up to a certain point, yes, it's good. But I think realistically, patients, when you treat someone who's, I guess, sun damage in Queensland at the age of 65, has been living in a cattle farm or with so much sun damage, you're going to treat them differently compared to, for example, someone in Melbourne who's had more sun protection. And that's just, just within that age demographic. And you have to, I'm not saying that fillers the answer for everything, nor low downtime procedures, but one has to be well versed in everything from invasive, whether it be facelifts, fully ablative laser resurfacing, all the way to, like we discussed, low downtime, no downtime procedures, the fillers, the BOTOX, and things like that.
Yeah, the bit of the RF needling and that sort of thing, that it doesn't take months to get over.
But the most important thing is to pick a treatment for that patient. Yeah. Right.
And for the patient to pick the practitioner that you're going to go to for your treatments.
Yeah. I mean, I guess that's that's the main crux. Is to actually I've been known to. I love my lasers. That's technology. Yeah. Yeah, but not every patient that comes in go, well, you need the laser. There's sometimes other better ways to address, for example, facial volume, right? And that's where fillers come in, because you can't replace volume with laser. In fact, you make things worse because you tighten skin, right? And it can actually make someone more gaunt because you actually tighten.
Do you find yourself like looking at people and sort of thinking, because I'm just looking at you now thinking, what's he had done?
No, unfortunately, in the movies, I mean, it's a true story. Very rarely do I actually, it's an occupational hazard.
Yeah, of course.
Very rarely do I go to the movies and not actually try to figure out what they have done. And I should do a podcast on celebrity secrets and what I think they've had done.
That's a really good idea.
And I should do that.
You definitely should. I love that. So one last bit. So 2019, which is now. So what do you think? I know there's lots of things happening. I know we've touched a bit on the micro treatments, but what do you see as being something that's coming more? Like what's coming up? There's always like a trend or something like that.
To be fair, I think when it comes to lasers, and you look at the evolution of lasers, you look at the evolution. Like I said, I was very fortunate when fillers came on board. Yeah. Now it's more little steps. It's not humongous leaps. Sure, in 2006, 2007, we had fractionated devices. The Fraxel came in, and the Cyton, the erbiums, the CO2 fractionated lasers, and pearls, and all that sort of fractionated laser resurfacing. That was a huge leap. And then from there on, it's been gradual increments. So from a laser and energy device point of view, I don't think it's going to be hugely exciting. It's mainly a spin of what's already been developed. But I think dual wavelengths, so dual wavelength devices. And once again, it's not new. It's been for the last 5-6 years, people have been incorporating dual wavelengths in one laser. Or you might have something like a laser together with microneedling, or laser together with radio frequency, where you deliver two energies which are synergistic. Once again, it's not new, it's just, I guess, a spin of the old technology. When it comes to just overall, I think once again, it's fillers. We're having fillers which are, I guess, more cosmetically elegant, with lower viscosity for certain areas, are nice and fine. It's like different palettes of different colours when you're painting. And you've got so much selection now to address the problems, and marked increase in safety, longevity, or shorter duration. Because there's some people, for example, I know that they're developing BOTOX which doesn't last 3 months. Actually, BOTOX will last a week or two, because you've got that, I guess, a new demographic of patient coming in where they've never had BOTOX before, and they're too scared that, hey, might not like this look, and it's going to last 3 months. What am I going to do? So shorter acting fillers and shorter acting BOTOX is, I think, is there, right? And it will be launched, I think, late this year. And I know that there are, I guess, variations of these agents they use in places like Asia, right? So it's another market.
The plastic capital of the world.
Yeah, absolutely.
Really. Which I don't mind, because they look amazing.
Genetics,
All right, so basically the trend is coming for better fillers, different types, and kind of just more injectables.
I guess when you look at energy devices, we discussed that,
Yeah.
fillers, skincare,
Yeah.
right? Skincare, and as you know, everyone starts from the basics and then skincare.
Yeah.
Are we taking a huge step forward, quantum leap forward? No, I don't think so. I mean, it's still, you know, our ABCs, which are very important, and your sunscreen. If you're going to name 4 things, that's it.
Yeah.
Everything else is, I guess, a spin.
Yeah.
And the most robust studies are actually studies which have been presented in the 1980s. You know, they're many years old now.
Yeah.
It's almost half a century.
Yeah.
Come to think of it, and that's what the vitamin A is and things like that.
Yeah.
Yes.
And that's true actually, because we were talking before about these sun care, and I didn't start to use a sunblock until I was in my late 40s as a result of a fractional treatment that I wasn't told not to go out in the sun. So
Are you
I
ethnic?
was, I'm Italian, Italian heritage. Yeah.
So, I mean, that's, you know, with ethnic skin. So PIH, with skin colour changes, is very common after laser.
Yeah.
So the most important thing, I guess, is take home message. You're going to invest in anything, it's sunscreen.
Absolutely. Vitamin A, vitamin B, vitamin C, and sunscreen is definitely a game changer. That's the most important skincare around.
If you think about it logically, a lot of things we see, I guess, on the skin, not under the skin, on the skin, or even, you know, superficially, is secondary to UV damage. Yeah? So if you don't have UV damage or reduce your UV damage, you actually prevent things to begin with. Yeah? So when we come to fine wrinkles, sunspots, even rosacea, you know, melasma, the top 3 things I see as a procedural dermatologist can be prevented with sunscreen.
Yeah, so true.
And it's just getting it on twice a day. And they always ask me, what's the best sunscreen? It's the one you're going to put on.
Yeah, so true.
Yeah. It's not the most expensive one. You know, UVA and UVB factors considered. It's just getting it on.
Thank you so much for your time today. So this is, if you want to look up Dr Davin Lim, so it's Davin, and then it's just Lim, and he's dermatologist in Brisbane. You can drop us an email to info@plasticsurgeryhub.com.au if you want to find out a bit more, or you can Google him as well. He's got an amazing YouTube channel as well, which I'm a little bit addicted to, but you know, I won't tell anyone. So thank you so much.
No worries. Yes, pleasure.
Thank you.
Thank you.
So.